And Marketing at Child Care Aware of America. And I'm here today to welcome you and thank you for joining today's Raise Your Hand webinar presentation. Child Care Aware of America's webinar series, Raise Your Hand, is a 5-month campaign to help shape the ongoing national conversation on opportunities that enrich the state of child care and early education in this country. The Raise Your Hand webinar series strives to raise awareness, about federal and state early learning opportunities that support child care, connect participants with content experts, and inspire all who care about early learning to take action to better the lives of working families. We are thrilled to have with us today Helen Blank, the Director of Child Care and Early Learning, working on child care and early education issues at the National Women's Law Center. Helen is an incredible advocate for children, and we're excited to hear from her today about the Strong Start for America's Children Act. Before I turn it over to Helen, I want to point your attention to the chat box function, which should be located on the right-hand side of your screen. Please use this function to submit or ask questions during the presentation, and we'll be sure to field those questions during the webinar. If you have more general questions, please submit those at the conclusion of the webinar, also via the chat box. Thank you so much, and without further delay, I will turn it over to Helen.
Thank you so much. It's exciting to be here with Child Care Aware because you are such a fabulous partner and you contribute so much to strengthening families' child care opportunities, making sure that that child care is high-quality child care is available in communities, and to supporting the early learning community. You've just been a long-time friend. And pre-kindergarten has strong roots in this country. It's always been part of our early learning system, and I think it's important to understand that we are actually scaffolding several large systems to build an early learning program, and that's not a new idea. That the President's initiative builds on what's happened before, and we really began in 1965. When Head Start was created as part of the war on poverty, and we've obviously heard a lot about that with the 50th anniversary of the war on poverty. Yesterday, Maria Shriver held an all-day meeting on women's issues, really focused on low-wage women, and Head Start was mentioned numerous times. What was so important about Head Start was it had 12 very prescient founders. And they understood something we hear all the time as we talk about the whole child. They understood that low-income children really needed a heads up, not only on early education, but they needed to have a program that was comprehensive, that reached out to their families. You couldn't look at children separate from their families, and you had to pay attention to their health needs, their mental health needs, their nutritional needs, as well as creating a strong role for their parents. What also I think misses a lot of people who look at the history was Head Start was created in the middle of the civil rights movement, and it was one of the first programs that gave African American parents in the South a real say in what was happening in their lives. And at the beginning, it was created as a summer-only program, and it was started very, very quickly, and over time it grew into a program that was all year, and there's been constant efforts to improve and strengthen Head Start through the years. But Head Start was our major early learning program. The funding went from federal to local. Why that's important to know is at that point in time, the states weren't so friendly to low-income families, and many states didn't trust, many advocates and policymakers did not trust the states with Head Start, and for good reason. So that's why Head Start was structured as a federal to local program, and Head Start now serves nearly 1 million 3- and 4-year-olds. And it serves the poorest children. Head Start's eligibility criteria is 100% of poverty, which is lower than most state pre-K programs and most state child care programs, although Kentucky's child care program now gets the prize for serving the lowest income families that match Head Start. Beginning in the early 1980s, even a little bit before, we heard talk of state pre-K programs, and governors started recognizing pre-K as part of their education reform initiatives. Texas did pre-K, not very high quality, one of the famously low quality programs, but Texas did pre-K when they did education reform in the early 80s, led by Ross Perot. Unfortunately, their ratios for pre-K equaled their improved ratios for elementary school, and that didn't quite work for 4-year-olds. But you heard pre-K tied to education reform in 1989. When Kentucky did education reform, they started their pre-K program. Many of these pre-K programs were mixed delivery. When President Bush came in, and the second President Bush, and Congress passed No Child Left Behind, governors got very concerned about children being able to pass tests in the 3rd grade, and they recognized that pre-K was a way to help ensure that children would be more ready. Pre-K now came into being, and it also spurred these increased state investments in pre-K. These initiatives were spurred by the research, and that's very important because we talk about evidence-based. The research has spurred investments in pre-K and Head Start. Currently, 41 states invest in pre-K at all different levels. It's universal in states like Georgia and in the District of Columbia. It's a full day, school day in Georgia for all families in the district. It's a full school day for all 3s and 4s. Some state pre-K programs are as little as 2.5 hours. Most serve 4s, with some states serving 3s. But there's about $5 billion invested in pre-K at the state level. So we have a good framework to build upon. Why should we invest in pre-kindergarten? I know you're all hearing a lot about this in this campaign to enact the Strong Start Act, but to review, pre-K helps children get the early learning experiences that they need to succeed in school and in life. Research is pretty clear about this. It helps to build a productive workforce now and in the future. If you have full-day pre-K, which is part of the Strong Start Act, you can help mothers with at least a full school day of early learning, and then they can, well, not perfect, but they can figure out how to wrap around child care before and after and during the summer. But mothers that have access to this kind of pre-K, like mothers in Georgia and here, say it helps them. It's a big chunk. Research is clear that this pays off. $1 invested in high-quality early education can save at least $7 in the future. A number of small-scale studies of an intensive programs and studies of larger state and local pre-K programs show short and long-term benefits. Improved academic performance in elementary and secondary school, reduced grade retention, decreased need for special ed, increased high school graduation rates and college attendance, higher earnings as adults, reduced criminal involvement. Now, you don't necessarily, the PreK preschool program, which is one of the most famous national studies, did not raise children's IQs, but children who participated in the program were more motivated, and you see the kinds of results that come from that, and you see tremendous cost savings. Art Romick, who was a vice president of the Federal Reserve in Minneapolis, talks about the fact that pre-K is a better investment than any football stadium that a governor could plan for. We have economists all over the country talking about what a strong investment pre-K is. As I talked about before, a full school day of pre-kindergarten helps parents work. We see very strong public support for pre-K. 4 polls reveal strong bipartisan support for investment of public funds in pre-K. A lot of agreement, again, not new, but stronger and stronger as time passes. The President came out with a plan for pre-K, which has been put into the strong, it really used as the basis for the Strong Start for Children Act. And under that act and under the President's plan, 4-year-olds whose families who have incomes at or below 200% of poverty, all of them would be served by the pre-K plan. And then after a state or city or county or local education authority served all the eligible 4-year-olds, 3-year-olds would be eligible for pre-K. Who can provide pre-kindergarten under Strong Start and under the President's plan? Local school districts, community-based programs including Head Start and child care, local education agencies in partnership with community-based programs. Some states that have pre-K now have a very high percentage of community-based programs providing pre-K. The Abbott pre-K program, which is our highest quality pre-K program available in all poor school districts in New Jersey, has about at least 60% of programs are run by child care and Head Start agencies. New York State has about 50 to 60% of their pre-K operated by community-based agencies, a higher percentage in the cities. Georgia, high percent. So much of pre-K is now characterized by what we call a mixed delivery system, and that would continue if the Strong Start bill was passed. Standards for programs. I think it's really important to remember that the research is based on high-quality pre-K programs. We get results when children have high-quality experiences, and currently not all state pre-K programs would meet standards for high quality. What does the Act require? Teachers have to have a bachelor's degree and demonstrated competence in early childhood education. There would be help for teachers. There's a set-aside to get that degree. Many states have provided help for teachers working in child care or Head Start to get their degree. When Abbott started, teachers had 4 years to get their degree, and the state helped them get that degree. There was not only money for tuition, but money for release time, substitute care, and in Abbott, teachers are compensated equal, teachers in child care and Head Start equal to public school teachers. Other states have and continue to provide help for teachers to get those degrees, and it's made a big difference, obviously, in teachers' standard of living when they get there. The House bill only says you have to have evidence-based class size and staff ratios. The Senate bill has a maximum class size of 10 and staff-child ratios of 10 to 1. All programs must meet a full-day schedule. Cannot do 2.5 or 4-hour programs 4 days a week. Curricula and early learning environments have to be evidence-based and aligned with states' early learning and development standards. I alluded to this before. Teacher salaries have to be comparable to those for K-12 teachers. That does not always happen in all state pre-K programs, even though there are more if you have a BA degree, so this is a very important provision. Ongoing professional development for all staff, ongoing monitoring and program evaluation for continuous improvement, health and safety service standards, and comprehensive services that include nutritious meals that could be met by participating in the child and adult care food program or school lunch program, screenings, referrals, and assistance with accessing services for vision, health, and development, family engagement opportunities, physical activity programs, and program coordination with Section 19 and Part C programs. And how do the states come into this? They have to have comprehensive early learning and development standards, the ability to link pre-K data with elementary and secondary school data. They have to offer state-funded pre-kindergarten to get into the program. They have to coordinate among early childhood programs. They have to develop performance measures and targets to track student progress in increasing children's school readiness and reductions in school readiness among groups of children. They have to have a state advisory council on early childhood education, which we believe all states now have. The Senate bill requires states that fund full-day kindergarten develop and implement a plan to increase the number of children enrolled. And if states do not fund full-day program, they must establish a plan for children in their pre-K programs to get full-day kindergarten. States must address the needs of dual language learners, increase the number of qualified teachers, and ensure that higher education institutions support this effort, develop a plan to support articulation agreements between 2- and 4-year institutions of higher education, establish an age-appropriate early learning assessment program, work with local entities to ensure sufficient facilities are available, although the bill does not allow funds to be used for facilities, and we know that's a big challenge, and ensure that pre-kindergarten will not diminish care for infants and toddlers. They have to coordinate with local school districts. Local pre-K providers must describe how they plan to coordinate and enter into strong partnerships with local school districts and other local early childhood programs. They have to be able to transfer records for each child to their public school, work with elementary schools to ensure continuity in teacher instruction and expectations for children's learning and development, organize and participate in joint training, including school transition-related training, engage families and elementary school teachers and principals in discussion of educational development and other needs of children entering kindergarten, help parents, including parents of dual language learners, understand services provided by their children's kindergarten, develop a system to reach underserved children, carry out a community needs assessment, support the workforce to gain credentials, and have strong partnerships with an LEA or community-based early childhood education providers. The state match is small in the first years, and it grows each year. The state match is reduced for states serving at least half of eligible 4-year-olds, and up to 10% of states' existing pre-K dollars now can be counted toward the match. I talked about a quality set-aside. 20% of funds would be set aside for not more than 4 years that would not have a match. That money could help teachers earn degrees. It could provide ongoing professional development for teachers, principals, and teacher assistants. Now remember, this bill will go through many iterations before it becomes law, so there would be a chance to maybe have that set aside last for more than 4 years. There's an additional important set aside in this bill. Not too many states have set asides for infants and toddlers in their pre-K bills. Illinois does, based on the Illinois program. This bill allows states, but that does not require, so that allows states to set aside up to 15% of funds for high-quality early childhood education and care for infants and toddlers from families with incomes at or below 200% of poverty. Funds can be used for full-day, full-year care to address the needs of working families. Obviously, that is an important add-on to the $500 million in the appropriations bill that was just agreed upon and has just passed the House and is likely to pass the Senate, that is set aside for new early Head Start child care partnerships. There are many state reporting requirements in this bill. States have to report on how they are increasing school readiness across all domains of learning, narrowing school readiness gaps, decreasing placement in special ed programs, increasing the number of programs meeting the bill's high-quality standards, decreasing the need for grade-to-grade retention, limiting chronic absences in pre-K, increasing the number and percentage of low-income children in high-quality early education programs funded through the bill, and providing high-quality nutrition services and nutrition education, physical activity, and obesity prevention programs. A lot of people ask about what is the role of Head Start. Remember, we talked about Head Start serving 1 million children, mostly 3s and 4s. Head Start programs can participate in state pre-K programs as a grantee, just like child care programs. The vision here is that eventually states would pick up most of the cost of state pre-K programs, or a larger and larger share, which would allow federal Head Start funds for 4-year-olds to be moved down and serve the large number, the very large number of 3-year-olds who are not being served, as well as infants and toddlers. Right now, we only have 4% of eligible infants and toddlers served in early Head Start. So this would allow what is happening in some states and communities already. It would allow Head Start programs to focus on younger children, but Head Start programs, just like they do in many states, could also be a provider, continue to be a provider of the 4-year-old services. Now, the Strong Start Act would be funded through the traditional appropriations process. We know, just having gone through a huge campaign to get as much money as we could of that process, that funding is very limited at the federal level for discretionary dollars, and will be more limited in the next several years. The Strong Start Act does not create another funding mechanism for a new pre-K program. The President's proposal would raise $75 billion over 10 years for a cigarette tax to fund pre-K, as well as $15 billion for home visiting. And you could argue that would have a double bonus, because you would not only serve all children, all 4-year-old children who need pre-K by the 10th year, you would prevent over 1 million, close to 2 million children actually, from becoming adult smokers. And you would also help to make their parents healthier, because they would not be smoking because of the cost of cigarettes. There are a number of states that have used cigarette taxes to fund children's initiatives focused on early learning, including California and Arizona. Cigarette taxes have funded both the beginning and the expansion of the S-CHIP program. But at this point, the Strong Start Act, as introduced in Congress, only would fund this through the typical appropriations process. And so when you're asking members to co-sponsor Strong Start, you are not asking them to support a new source of revenue or a new tax. So that is the skivvy, both on the Strong Start Act and the roots of it. And I'd be happy to answer questions.
Great. Thank you so much, Helen, for that presentation. It looks like we do have a couple questions that are coming in here. So if anybody has any questions that Helen has not yet answered, please feel free to type those into the questions box on the side of your screen. But the first question that came in is, what is the definition of full-day pre-K?
At least 5 hours. It's based on what your state's full school day is, how it's defined.
Okay, great. And then a question came in that says, if there's time, can you speak to the Early Head Start Family Child Care Partnership?
Sure. A very exciting part of the appropriations bill has $500 million for new Head Start early Head Start partnerships. It's estimated that 40,000 new children could get early Head Start. I think we have to wait before we use that widely. But what would happen is this money would go to every state. There would be a certain amount of funding based on the number of low-income children. It's really the Head Start formula to every state. Within that state, programs will be able to compete for funding, and they either new or existing early Head Start programs who get the funds. You don't have to be an existing early Head Start program to enter this competition. The funding would be available to partner either with local child care centers or family child care providers serving low-income infants and toddlers. The definition of low income is the early Head Start definition, which is poverty level. It's not the which is different for CCDBG in most states. Funding will be available to help child care programs meet the early Head Start standards and for training and technical assistance to the child care programs. These programs are envisioned to have CCDBG funding, which would provide the core funding. So you would be adding the early Head Start funding to the CCDBG funding, which it's envisioned that you'll be able to pay infant toddler teachers more out of this pool of money. So you would have more highly qualified, you'd have more high quality infant toddler programs, and you would have more highly compensated infant toddler teachers. And I'm sure we'll see more about how this is going to be rolled out as the RFP gets developed.
Okay, great. One of the questions that we see here is part of the funding for Strong Start taking funds from Head Start?
No, and that's why it's quite interesting how this works. And I think that as states were expanding pre-K, this maybe one day would have eventually happened over time, that states would be serving fours and Head Start could serve younger children. The Head Start dollars that are currently there, that are serving fours, the Head Start part of the $8 billion, would stay with the Department of Health and Human Services, and they could be reprogrammed to serve threes and infants and toddlers. And Head Start programs could continue to serve fours with money in Strong Start and state funding. So you would just have the federal Head Start program would be for children 3 and under, but it would not lose money. The money that is now serving children who are 4 would be used for younger children. And we know that's a little hard to wrap your arms around.
Another question that just came in says, do you think this is an opportunity for those states that didn't receive Race to the Top early learning grants to get some assistance?
I actually don't. I think it's a little confusing, and hopefully there is going to be a conference call with Libby Doggett and Linda Smith next week. The part of the appropriations for FY 2014, this wonderful package that we and all of you helped to get on early learning, includes $250 million for preschool development grants. That is not an expansion of the Early Learning Challenge Fund. If you read the bill and if you read the report language, that funding, even though it's included in Race to the Top, which is where the challenge funds were funded out of, and they were really funded out of there as a way to get the money, it's going to be awarded competitively to states, if you look at the language, to build their capacity to develop, enhance, or expand high-quality preschool programs for families below 200% of poverty. And then there's SCUB grants can go to LEAs and other early learning providers, such as Head Start and licensed child care providers or a consortia. So this is really a pre-K focused grant, and there can be 2 types, one for states that don't have preschool or only small preschool programs, and another for states that already fund sizable pre-K programs. And funds can help teachers get higher credentials and degrees, and you have to follow the National Research Council's recommendations on appropriate use and practices for assessment. So it's really, if you remember the President's budget, there was $75 billion for a new pre-K program supported by a cigarette tax. There was $750 million for preschool development grants that would be focused on states that didn't have a pre-K program yet to get started, or to improve the quality of pre-K in states who wouldn't meet the qualifications for the bigger pot of money. So it's really not a challenge fund, and I think the group of states that will apply don't have to be, will not be necessarily related to the challenge fund. There will be states who apply who probably don't have a challenge fund, but I don't think you'll be precluded for applying if you do, because it could be a different group of states. And again, we'll know more as this develops. That's my understanding now.
Great. It looks like we have a couple questions that came in regarding a copy of today's PowerPoint, and I just wanted to let everyone know that today's webinar has been recorded, and we're going to post it on our YouTube channel, which is youtube.com/CCA of America, and we can also put a copy of the PowerPoint up on our website under our webinars section. There's a question that just came in here that says, what is the definition of pre-K? And what is the definition of preschool? Is there a difference in this legislation?
In this legislation, you have to serve 4-year-olds first, and remember, and then if you serve them all in a state or a locality, I mean, for example, if New York, if Mayor de Blasio is successful, there'll be universal pre-K for all the 4s. You could use this money for the 3s. Preschool and pre-K is interchangeable for the purposes of this legislation.
Okay, great. It looks like that wraps up all the questions that have come in. We can give everyone just about another minute to get their question in if something just popped up. Oh, it looks like we have a few that did just come in. Let me take a look at those. The question is where is the handout going to be posted? And if you go to our website, to usa.childcareaware.org/webinars, there's a list of all of our webinars that we have hosted and that are upcoming, and you can access the PowerPoints on that website.
I noticed that there was a comment that I really hope a mixed delivery system is guaranteed. You know, the bill does talk about mixed delivery. It's very strong on mixed delivery. It doesn't mandate mixed delivery. It uses the word or instead of and I think, again, this bill is only at the beginning. Remember how much legislation changes through the process. So that, you know, there can be attempts to change that. But if you look at pre-K as it's developed in the states, much of it, except for a very few states, is mixed delivery, especially in the states that have done this in the last 10 years. But you know, the state of West Virginia, which no one sort of looks at as thinking, oh my God, they serve over 60% of their children. They actually legislated universal pre-K more than 10 years ago, and they have a stronger Head Start than child care system. Most of their pre-K is delivered in Head Start. So I think if you look at state trends, you see a lot of mixed delivery in that. That's going to continue.
Okay, another question that came in says, is this considered a block grant?
This is definitely not considered a block grant, and that's an interesting question. A block grant means that you give enormous flexibility to states. I mean, one of the challenges was, you know, in order that over time there was very little sympathy for many requirements in the Child Care and Development Block Grant. I know that's something that Child Care Aware members are, concerned about. This bill is based on the research, and the research says that in order to have pre-K programs that show results for children over time, you have to have high quality. Only 3 in 10 4-year-olds enrolled in pre-K are in a high quality pre-K program now. So this bill is about ensuring that states who get this money, it has strings, and the money has to be for high quality pre-K programs. It is not a block grant. It is focused on a certain age group of children with set-asides for younger children and provisions to serve younger children if you meet, you meet your targets. But it is not a block grant. It does not say to state, it gives states some flexibility in terms of their current programs. It doesn't say, for example, and this was an issue, what agency has to run the program. Many pre-K programs are run by state departments of education. Some sit in state departments of early learning. The North Carolina legislature changed their program, which had more at 4, which had been the Department of Ed, moved it to the Department of Human Services. This bill doesn't make you move your program around. So there will be some flexibility, but it is not a block grant.
Okay, another question that we have here says, could you explain a little more about 15% on one slide the state can set aside for early childhood programs?
Sure. Obviously, we have an enormous shortage of infant and toddler care, and it is the most expensive. And has been historically, although we don't have hard evidence that as you expand preschool, you lose infant toddler slots. You may lose them because a preschool child care center finds it more profitable to open a 4-year-old classroom, and that means they close an infant toddler classroom. Or a school may offer preschool, and a child care program may not be able to be viable without its 4-year-olds, and it closes down, and you lose infant toddler care, or family child care providers lose 4-year-olds. But we don't have hard evidence on this, but we know we have an enormous shortage of infant toddler care. So what the bill says, which was not in the President's earlier President's proposal, is that a state may choose to set aside 15% of their allocation for pre-K for infant toddler care, and it has to be for high-quality infant toddler child care. It doesn't mandate it. It is a voluntary set-aside. It's, again, based on a set-aside that Illinois has in its pre-K program for infants and toddlers. So, if this passed as is and was enacted, we have a long way to go, and a lot of that will be up to your efforts. You would have to work in your state to encourage your governor to put that set-aside in place.
Okay, great. I think that answers all of the questions that have come in except this last one, just asking for the website again to access the PowerPoint. And again, that is usa.childcareaware.org/webinars. So we'd like to thank Helen for today's presentation and everyone for joining us for this Raise Your Hand webinar. And just a reminder, we have the final webinar in our series coming up 2 weeks from today. And you can also register for that webinar on the website that I just gave. So I'd like to thank everyone for taking some time out of their day to join us, and we look forward to seeing you on our next webinar. Have a great afternoon.